Good morning, everyone. Thank you for inviting me to present a lecture on the topic on research in yoga. As Professor and Principal Sir said, I'm quite passionately associated with yoga related publications, research, and also a kind of introspection in knowing how it works. Vedantri and Vedantri Maharishi's followers, Vedantri Maharishi College, its establishment in Aliyar, Temple of Consciousness, made very big contribution in my growth and my insightfulness. We will make this presentation in an interactive manner. So anybody at any time, please feel free to stop me and ask any questions. But after the completion of the talk, we will certainly have a quite detailed discussion. Most of you who are joining the PhD career today, first of all, my best wishes. You all have come to this concept because of few reasons. I heard from madam that there are few people who got the medical background. That is very encouraging to see. The most important thing is your interest in yoga. The second important thing is to do some research to the level of getting a PhD in it. The third important thing is what we are taking it to the community and what we are giving back. We are born, we are living, and tomorrow we are going to disappear. But this yoga has given us this life in between the birth and death to shape into a good form, while our research and our contribution should make the life of others and life of this community in a much better way. At any stage, if any of you are interested in discussing how to select a good topic for research, especially in yoga, especially in Vedantri Maharishi's simplified Kundalini yoga or exercises, I'm quite happy to help you. And also, I'm happy to help you in setting up the study methodology and statistics and future things. I've done many talks to Vedantri Maharishi related presentations, of which the main thing is on science of yoga. What is the evidence behind yoga? And I've done talk on most of Maharishi's principle like science behind eye exercises, science behind Kaya Kalpa Yoga, science behind Maunam, silence, science behind the fasting. We have done most of the things, and I'm very passionate in researching the science behind what we are practicing and what we are preaching. In this introduction series, today's talk, I'm going to discuss on research in yoga. We are going to critically examine the methodologies, what are all the existing findings, and what are all the future directions. Usually for these kind of presentations, we used to have a kind of PowerPoint presentation and use the slides to present. But when I try to prepare the slides, I come across my own book. This is the book Research in Yoga. I'm quite passionate in writing the journal articles and books. And in this book, I've done to my best quite in detail on how to do research and what is happening in the research in yoga. As you can see, the book is available to buy. If I have a PDF or copy, I will be quite happy to send it to Shanti Madam so that she can distribute. In this book, the main focus is on research, how we can perform research in yoga. It starts with various introductory chapters, methodology, what is the research findings, mechanisms, and limitations, and what we can do in the future. I'm going to use my own book as a kind of background so that we can discuss this research much more in detail. If somebody wants to buy the book also, I can give a link bit later. This book provides a very critical overview of the current state of the yoga research, what are all the methodologies employed, What is the findings across the diverse populations and outcomes? Where is the limitation? And how this will emerge in the future? Before getting into any research, first we need to know the background, what is already existing. Say, for example, if somebody wants to know about how the Kayakalpa yoga works in a person, and one of you are taking a topic like impact of Kayakalpa yoga in somebody's liver function, something like that. I'm taking some random example, and I've helped so many scholars in selecting the topic, especially in vision earlier. So I'm quite happy to render the same help for the Chennai College also. So first thing what we need to do is, there is yoga which is very established. We have got a specific method to do it, Kayakalpa yoga, and we have the liver function test, physiology of liver, how liver functions, what are all the problems liver may have. So we need to know the background of these two, and then read about the liver diseases, etc. for maybe few days or 1 week, and then you may be already knowing Kayakalpa yoga, but know a little bit more about what exactly Maharishi said, what exactly other scholars said, what is published about Kayakalpa yoga. Once you do these two things, you got a good background, and from there you can write your study hypothesis, methodology, and how to frame it and how to take this forward. Keeping up with the research topic, I've done quite detailed talk on how to use the research engines like Mandolin and few other things in the past. I hope the recording will be available. Shanti madam, if there is any need for any recording, just message me in WhatsApp. I will send you the recordings which can be used by the new research scholars.
Sure, sir.
Okay, ma'am. Now, if we briefly trace the origins of the yoga, how we can differentiate it from the modern interpretations, etc., the yoga can be divided into ancient roots as per the Florestan's focus. All the material what I'm using in this presentation is with appropriate references. So there is a reference behind. These kind of presentations, sometimes without PowerPoint, going through a kind of a draft will also give you a kind of an encouraging idea on how to draft a good research article, how to make it in a bullet points with highlighting few things in bold, few things like subject of discussion, and how to reference itself is an art. There are 2 3 ways by which we can reference. For example, this ancient roots I can refer by putting within paragraphs 1, and in the reference list later I can put one as, for instance, focus and what is publication actually done. That is one type of referencing. There are various types of referencing, ABP, Vancouver, etc. But this type of referencing where we just put the author's first name within the brackets quite next to the sentence itself will give a very good idea about what we are talking, and that gives that author also a kind of an uplifted presence in your draft article. So the yoga starts from the Vedic period, which dates back to 1500 to 500 BC. Upanishad period dates back to 800 to 200 BC. And classical yoga, which is quite modern, dates back to 200 BC to the modern 500 AD, which is also called as CE. So by knowing the basic history, we know how it is evolved, and we also know that what we are doing modern, how much it deviated from its classic roots. Say, for example, in the Vedic period, the primary focus is in liberation and getting ourselves free from the difficulties of life or challenges of life. That will be the primary aim. But later in Upanishad period, we got into various other things like exercise, postures, etc. Then in classical yoga, with the introduction of Patanjali, we have come across the Ashtanga yoga, and that 8 steps which clearly focuses on the goodness in life, how to remove the badness in life, how to have a proper posture, how to have this breathing exercises. So everything is tabulated very nicely by Patanjali. That taken the yoga from the basic of resolving problems and getting an uplift from the basic life to getting a strong body, strong mind, and also taking it further to see how we can get into a good human also. And then this is according to ancient roots, according to Florestan. Then in the medieval period, the publication from Florestan and Singleton, it clearly showed a little bit more focus on asanas and postures. And as this focus on asanas and postures emerge, that primary Vedic period concept of like enlightenment, understanding the life, getting into an upliftment in life, that has slowly disappeared. And once the ancient focus have improved, we can see that the spiritual liberation, mind control, asanas have become more of a tool of physical well being, physical practice, with less emphasis on spirituality. There is no discussion of God. For example, in the Western world, as you may all know, I am practicing in England. So, most of the yoga institutes here have nothing to do with any religion. Sometimes a institute may be run by somebody from Spain, and he or she will run the yoga institute quite successfully just by teaching the postures, not even getting into the breath work or not even getting into any spirituality concept of it. Obviously, there is an element of commercialization. People want to establish a yoga studio with a good amount of income, good amount of feedback. Now it's gone to the level of like Instagram, Twitter, that kind of era. Even though these things have happened, there is a primary basic concept that yoga is for both spiritual enlightenment and also for goodness of the body. That we can't forgive. So, in short, there is a big difference between the ancient yoga and modern yoga. And by understanding these two concepts, it will help you to form a research topic in a much more structured manner. Whether you want to think in a classical manner, like for example, as I said, impact of Kayakalpa yoga in liver diseases, it's a very modern thing. Yoga was not designed to remove the liver diseases. As I mentioned, the primary classic reason for yoga is for liberation, is to understand the purpose of life, is to understand enlightenment. Not to do goodness to others, not to do goodness even to your own body, your own physical and mental health. That's not the primary area. But things have changed and things have become more modern now. So this kind of basic work needs to be done. So similarly, if you want to do a topic, do some basic work on the topic, on the yoga, and try to see how you are going to marry those two topics and write an hypothesis, and do it in a very methodological manner so that you are not wasting your time. I don't think any of you will be a full time doing only this research. Some of you may be having a practice, some of you may be having some hobby, some of you may be working somewhere. And even if none of these things are there, at least some of you will have a family, maybe a wife, maybe a husband, maybe a child. So you may be quite busy with other things also. So doing this in a very intelligent manner, in a very methodical manner will save a lot of time. So involve your faculty. I'm quite happy to help. As I said, as Principal Aya said, I am also one of the faculty. Please use me and try to get a kind of a clear methodology in the early state so that you don't have to do a mistake, work on that for a few months and then go back and rewrite the methodology and take it from the scratch. The next thing is we need to define yoga for research purposes. I am speaking this on a very broad concept of research in yoga, but for each one of you, you may be having a specific topic. The broad concept will give you only a broad idea. So The concept is how to define the yoga from the research point of view. And there are various yogas, like for example, Hatha Yoga, which is of postures, asanas, which we can label at our own simplified Kundalini exercises or simplified physical exercises. Raja Yoga, which is of meditation. Bhakti Yoga, which is of worshipping the God, which is not much related to Vedantarian principles, and Karma Yoga, which is indirectly what we are doing now. For example, my presentation today is my Karma Yoga, and similarly, you may be having your own Karma Yoga in your life. And this variety of practices like asana, pranayama, we have everything equivalent in our Vedantrium. Say, for example, asanas, we have simplified physical exercises. Pranayama, we have Nadi Sutti. Meditation, we have plenty of meditations, and you all may be knowing various types, right from a very simple quick meditation like how we have done today to the level of like Turyadita meditation, Panchaloka Navagraha meditation, etc. And yoga goes beyond the pranayama meditation in the form of like mudras, etc., which is also quite a big part of our own Vedantari's principles. And how this influences an individual person and a community. That's the next thing. So individual focus, how it influences a person is age, fitness, experience, etc. How instructor will be an influential person, how the environment makes a difference. So you may be doing yoga in Chennai. I was born and brought up in Chennai, but you having a yoga session or retreat in Chennai may be entirely different from a retreat in Alia. We know how the environment and settings differ. And what is the intention? Again, if a person comes to you, I will take the same example of impact of Vedandriyam's Sky Yoga principles on liver diseases, for example. I don't know why that example came to me, but I will use that example for the whole talk. Someone you are testing and you are recruiting to your study to see the impact of these exercises in liver diseases, that person may have some problem. Sometimes he may be an alcoholic. Sometimes he may not be an alcoholic, but he may still have fatty liver or some liver changes because of his food habits, because of genetic inheritance, etc. So we need to know what are all the etiology factors of the liver diseases, which I have discussed already. And then the motivation of that particular person may be like, I'm going to contact this PhD scholar, or the PhD scholar is contacting that particular person mainly for the purpose of goodness of the liver. So he is going to tell me few things like do this meditation, do this positioning, do this 14-point pressure of the tummy, which is a very good big tool in improving the strength of the liver. And I'm going to follow this because I'm going to improve my liver function. That may be the only aim of one of your participant. While the another participant may think like, I want to have a good digestive system. I want to have all the problems removed. I want to come out of alcoholism. That may be in another person's aim, intention or motivation. Another person may really want to improve the life completely. For example, he or she may be a teacher. They want to become a good teacher, produce good students, and improve the energy, improve the efficiency. So the motivation of individual participants of your recruitment in your study, in your PhD program may entirely differ, and based upon them, the outcome may be differ. Somebody who is coming to you with a wholesome health, asking for like, doctor, give me a good meditation technique, I wish to do all the physical exercises, I wish to look young, I wish to look for longevity, I wish to look for everything possible in yoga. That's a different concept compared to somebody who just want to improve the liver function test alone, or compared to somebody who just want to come away from alcoholism. And it's quite challenging to measure sometimes. You may be able to measure the liver function test, for example, but after 1 month, if that person comes to say that I'm feeling so comfortable, doctor, I'm able to sleep early, I'm able to get up early, I feel something good in me. How you will measure that good a kind of an internal happy feeling which the scholar, which the participant informs you. It's very difficult to measure. We can measure only some physical and some mental components with some scoring systems, etc. And few things what we need to know about the research is the words like specificity, standardization, etc. Say for example, specificity means we need to see that how specifically that particular yoga kind of intervention helps that particular person. As I said, the particular person may be already living in a very nice higher economic state, but unfortunately end up having alcohol habit, and because of this he's approached by you or either way to get rid of the alcoholism, and you're giving him some advice regarding Vedantari's life principles, exercises, introspection, etc. So for him, the primary aim is very specifically for the improvement of the health. While somebody from a lower socioeconomic status, the primary health is a secondary one. The primary one may be his main job, work, earning, etc. So we need to approach the research in a very standardized manner, in a multimodal manner, and we need to think about the effects it makes beyond the physical effects also. As I said, in this book, the references are managed or mentioned quite frequently. So this is one of the good way. You can divide your research and you can put your references then and there so that we know from where these references were taken. Now, another problem is heterogeneity and inability to report completely. What is heterogeneity? As we have already seen, yoga is like a multimodal one. Even our Vedantari Maharishi's yoga has got various life principles like introspection, Sinamtavittal, etc. and various physical components like exercises. And Kayakalpa makes like a universally a combined component, and meditation takes everything to an higher level. So there is a problem of heterogeneity. If you have the same example of improving a person's liver health as your PhD thesis, if somebody really have LFT done, bilirubin level taken, alkaline phosphatase level taken, all these things done by a blood test, and after your intervention with yoga, you've done a blood test in 6 weeks time and there is an improvement in the liver function test. But there is a heterogeneity. You can't say that impact of Vedantarian principles in a liver function test or liver health. We need to find which type of exercise made which type of health improvement. As I said, Vedantarian principle of 14-point pressure, which we do in our tummy in the morning exercise, is a very important thing in using our own energy to improve our own liver, spleen, intestine, bladder, all the organs' health. But by giving that person a 14-point pressure, exercises, meditation, Kaya Kalpa, we don't know which one is the reason for the improvement in the liver function test. That's where the heterogeneity comes. And inadequate reporting. Sometime patient may not come at 6 weeks, they may be out of station, and you may be correcting the blood test at 8 weeks. So there is a component of inadequate reporting. So we need to be specific in which yoga style we are going to use in our study. What is the content and sequence of practice? What is the frequency, duration and intensity through which somebody is doing? Somebody may be free and like a homemaker, for example, and after sending the children and husband to the job and school, they may be having more time to practice, and so they may be practicing more intensely, and they may get the liver function test into a better state much more compared to somebody who is working from morning to evening. So we can't average this and say that simplified Kundalini yoga and Vedantarian exercises gives this much of improvement in the liver function test. No. It depends upon the individual person's frequency, density and intensity. So that's why writing a methodology, what are all the quantifying things you're going to measure, makes a very important aspect in your research. And what is your qualification, your experience, how much you have understood the concepts and science behind it? How are you going to deliver? Sometimes if you just focus only on delivery to the people who are coming closer to you, like your own yoga institute or your own living area, you may be able to recruit only 10, 20 people. But a lot of times, maybe with a WhatsApp video call, you may be able to recruit your friends or acquaintances from very far distance. But if you recruit a person who is living in Tiruchi while you are sitting in Chennai for your research, then sometimes it's very difficult for you to physically teach something, and you may need to get help from a local master. And those kind of mode of delivery will impact your study outcome and measurements. And what is the theoretical framework on which you are working? And the main thing is replicability. If you do the study and if you find that liver function test is improving in 6 weeks time, that's your final outcome, is it possible to replicate it when I do the same study in England where I am now? Is it possible to replicate it in countries of Islamic origin like Middle East or Pakistan or something like that? Improved comparability. How can you compare this with some other Chinese tradition like Tai Chi or something like that? How to interpret the results in a correct manner, how to do a evidence-based practice, how you can publish it so that others can use it also, and what is the advancement in the field. So those are the things we need to consider. And there are a lot of distinctions in the holistic yoga, as I said, from the specific yoga practices like doing only asana, like modern Pilates, like yoga studio, etc. So you need to be able to see which type of things are useful for which type of things. And a very rigorous research is needed. We need to make sure that we are aware of the limitations. There are lots of effects like placebo effects. Somebody who is doing this yoga, just because they are doing this yoga, they will start feeling good from the day one onwards. It's a placebo effect. They've not done yoga even for few days to the level of enjoying or feeling the difference. Placebo means they believe that from today, Monday onwards, I'm going to do yoga. So that feeling itself will give them a goodness, a smile. They'll be getting up a bit early. So it's a placebo effect. The effect is not due to the yoga. The effect is due to a pseudo comfort, whatever they believe. Regression to the mean, which means, as I said in that same example, a yoga can improve the liver function test to a very excellent manner. A very bad bilirubin test or fatty liver test can become very clear. The scan shows that the whole fatty liver disappeared, etc. Or there may be a very mild improvement. But overall, we end up into the regression to the mean. We come to a conclusion that as an average, this is the outcome for the research. It's good for publication, but the truth is there are some people who performed and who had improvement very minimally, some people who had very excellent results. That's a difference in the whole spectrum of the results. And confirmation bias. There may be bias in confirmation because if you're doing this test, for example, the same impact of yoga on the liver function test, you already know or already you have a bias that 100% my yoga interventions, my sky yoga instructions, my kaya kalpa is going to improve the liver function test. So that creates a kind of a colored glass, and you're thinking, you're believing that the result is going to be this. It's a bias. That's a confirmation bias. And there may be a sampling bias. As I said, you may be able to sample only from people from Chennai. What happens to the same thing given to somebody living in Kallakurichi, somebody living in Kanyakumari, maybe somebody living in village may have much better enhanced liver function test recovery compared to somebody living in a city like Chennai, Bombay, or Calcutta. And randomized control trial. That's a very important backbone of your methodology if possible. You can have a control arm, you can have an intervention arm. We have helped so many PhD students in our vision to conduct randomized control trial and how to select the subjects, how to randomize them into different groups so that you can compare the intervention group with the control group. I think these things you all know, so I don't want to get into very basic talk, and when I'm talking itself, you can understand what I mean. And the protocol should be clearly defined. At any stage, if the protocol is going to be changed, we need to mention it quite clearly. It's a version 1, it's a version 2, it's a protocol change, etc. So it could be very, very methodical approach. You can't just like that halfway through think like, oh, this alkaline phosphatase measurement, the lab charges too much, let us remove this alkaline phosphatase blood test and keep other things and do the test. It should not be like that. You have a methodology. If there is any deviation, you should clearly define it. Valid, reliable outcome measures. The lab should be standardized one. Scans should be standardized one. And you need to use some basic statistical analysis. We also had many sessions on statistics in the past. All the recordings were available. I'm quite happy to send some important recordings on a later date. The bias is the one we try to remove as much as possible. Say, for example, researcher's bias, my own bias that this study should show improved liver function test. It's a bias. Participant bias, as I said, the participant may think like, I'm enrolled in this study, I'm pretty sure I'm going to have a good improvement in the scan finding of the fatty liver. It's a participant's bias. Publication bias. Sometimes when you publish your studies, you may have to go to a specific journal. That journal is more interested in, for example, the liver function and liver diseases. So the whole publication, you'll be writing more about how the liver works, what are all the problems can happen in the liver, and how the yoga helps in preventing or curing the liver disease. So that will be your primary aim. You will be losing the yoga component of your publication. And as I said, again, when you're writing your article, there should be a good highlighting or bold marking of some important things with appropriate references then and there. And there are some anecdotal evidence. Like, for example, I am telling you that the yoga has these kind of advantages. So this is an anecdotal evidence. Don't have that as your limitation and use your own study and your own unbiased approach in your research. Establishing the causal relationship. Causal relationship means because of that only this thing happens. So you are doing an intervention of a specific yoga type, like our Vedantrium yoga, to a group of 20 people, and they have improvement in the liver function blood test. Is it the cause? The cause of simplified exercises and outcome of improvement in liver function test, is there a direct cause? It may be in most of the people, but if you select some individual people, somebody may have changed something. Because of this participating in the research, somebody may have come across an article which says like vegetarian food is good. So somebody may have changed from non-vegetarian to vegetarian. So that may have an impact in the result. So we need to know what is the causal relationship for the outcome. And what is the mechanism of action? This is another thing. Just by doing the study and saying that Kaya Kalpa 14-point acupressure gives this improvement, that is good. But you need to know how the 14-point acupressure works. How the biomagnetism from the fingers, we are able to send it to the specific organ, how it works. So those kind of mechanism of action should be studied in your research. And appropriate dosage and style. As I said, somebody, a homemaker, may have a lot of time and the dose of the exercise they are going to do is more compared to a person working 7 days a week. And what is the style of their work? And potential risk. Sometimes all the exercises, there are some small risks here and there, not as bad as the exercises with the weightlifting, etc. But we need to make sure that our participants in the study are not affected by the risk, and we are explaining the risk quite in detail. And how finally we can integrate our research finding into the mainstream healthcare. As you all know, mainstream healthcare is predominantly an allopathic one. I am an allopathic doctor. And if you find something, how you can take, for example, in our own example, how you can take this example to a hepatologist, a liver specialist, say Apollo Hospital, Greaves Road, liver and bile health, there is a department there. How you can take this to them and integrate into the mainstream healthcare system. so that instead of just giving a prescription of, say for example, live 50, live 20, or some tablets or some injections or some medicines alone, how that particular healthcare practitioner can say that if you do this kayakalpa, if you do this 14-point pressure, your liver function test will improve, how you can integrate into the mainstream healthcare. That's very important. Just by doing a research, you're doing something good, maybe to you because you are getting PhD, maybe to your participants because your participants are getting some better one, but it should be integrated in the healthcare for the future propagation into the whole population. That's very important. So by this, now you may have got a good idea about how this research in yoga is so vital, how we can formulate it, how we can apply it, and how we can take it forward into much more better stages. There are lots of ethical problems. We need to get an informed consent. The patient or the participant should know about the side effects and happy to take part. There is nothing like exploitation. Sometimes when you're doing this yoga, if you want to have 20 people and you got 18 people, you don't have two more people to recruit. There is no way you can recruit. People are not accepting it. You may exploit your brother, your sister, your father, your grandfather to say like, I'm doing this study, it is very important, I need this one more participant, so it's good for you also. So you are exploiting your relationship with others to recruit them. There may be some culturally, there may be some difference. Sometime if you say recruit an Islamic person, that particular Islamic person may think the yoga what you're teaching seems to be more of Hinduism. It's not culturally appropriate for them. Even though our Vedantri Magrisham is a very secular, non-religious one, it can misrepresent. We need to handle that. And there should be beneficence and non-maleficence. There should not be any forceful recruitment. There should not be any hidden reasons for recruitment. The study alone should not be your primary aim. Your research is an important thing, but forming importance out of it, a good outcome out of it, doing something to the public, doing something to the whole healthcare should be your big idea, not just completing 20 patients control, 20 patients intervention type of study. And keep all your data in a private manner. No way the data should be exploited or shown to others. So keep your data in a secure manner, possibly in a paper which is securely kept, or a laptop which is locked completely, etc. By keeping the data private, the patients will have confidence, the participants will have confidence in you. You can't tell one participant that that particular person, Shiva from 7th Street, had very good improvement. So if you also join, you will have improvement. It's very common, especially in India. While that Shiva may not be happy in you showing his improvement as an evidence to improve your study. We need to take that into account. And there are diverse styles and traditions, and individual belief and worldview may be different. Various practices, language. Sometimes you may have to talk in Tamil, sometimes you may have to talk in English. Very rarely somebody may be of Kannada or Telugu. And what is your researcher's reflexivity? You need to be quite reflexive and quite accommodative to get appropriate participants. And sometimes it's very difficult to generalize. If that 40 patients in your study got improvement, we can't generalize and say that 40,000 patients, 40 million patients in the world are going to get benefit. And don't interpret inaccurate results. Reinforcement of stereotype. Stereotype means we all know if you do yoga, you will be good. You will look good. You will get better. Liver function will improve. Respiration will improve. This is the stereotypical belief. There is no point in reinforcing the same stereotypic one. We need to find something good, something unique. And integrity is the one, as I said, truthfulness, not losing the confidence of the participants. The methodology of this yoga may be by different methods. Like for example, there are standardized methodology, there are dosage related methodology, various methodologies available. Control group issues. When you select some control group, sometimes halfway through the particular control group person say, doctor, I know you have kept me on control group, you're not giving me any intervention, you are measuring how bad my liver function is going to be, and you are comparing that with the people you have intervened with yoga, so I'm not in the correct position. So that person may feel bad. So that's why this control group and the intervention group is randomized. So they're not selected just because you want that person to be in control group, that person to be in intervention group. It's randomized, it's unbiased. Outcome measures, when you are measuring, suddenly you may feel the calculation may be difficult. Statistics may be difficult. So that may end up in a very wrong answer. Sample size and power. Sometimes the study is not powered enough to get the outcome to say that yes, this particular yogic intervention will cause improvement in liver function test. That you can't say just with a sample size of 20 or 30. You may need even 200 people to enroll, depending upon the particular study. You can discuss a good methodology, select a topic in 3 different ways. How yoga can affect the mental health. There are various studies happened on depression and few other things also. How it is helpful in physical health, how it is helpful in special population. Special means not necessarily a very handicapped population or mentally incapacitated population. It could be children, it could be pregnant ladies, it could be a particular a mill worker. So these are all like special populations. You can plan your study in those kind of special population group. And you can focus on the physiological mechanisms. So as I said, how the liver function is improving, how it's getting better. You can do in a psychological mechanisms, how quitting smoking improves somebody's thought clarity. There are some questionnaires for it. You can use the questionnaires to see how psychologically it works. And you can do in an integrated mode also, because end of the day any intervention you do will give both physical and psychological improvement. So there are lots of methodological limitations. Fortunately, I can help you with good amount of methodology, how it can be done in a correct manner, since I do a lot of research in England and it's much more standardized and we got more exposure, I will say. And the priority is not just to find something like this particular yoga is good for this thing. The priority is to know how exactly it works. Is it possible to take it to the general public? Is it possible to integrate into the normal healthcare? That should be our future research priority. And how it is going to be practiced, how it is going to be into a policy. Say for example, our central government is made a policy of like this World International Yoga Day, World International Meditation Day. So these kind of policies, how we can create out of our research, which will have better implications on wider group of population. So this is a good book which I am now using to explain to you how role of yoga is useful. I thought of making a PowerPoint from this, but I thought instead of using the PowerPoint, I can show you the book itself, which has got a good amount of extensive research and references. And I'm pretty sure this book will be a quite handy one for somebody who wants to learn yoga, somebody who wants to start a research topic in yoga. So I will stop here now to see if you all have any questions in it, and we can answer the questions and take things forward. The book is available both like an e-book and also as a physical book. It's known as Research in Yoga, Critical Examinations. And if somebody wants to buy the book, this is the QR code. You can use your phone to scan this QR code. That will help you to take you to the site where you can buy the book. I will keep the QR code open. When if there is any questions, I can answer the questions and I can take things forward. Any questions?